Hi everybody, Christian Nix here. I want to talk to you in this video about the difference between something, and this is actually for those of you who are just finding the Pivot Protocol, if you're just discovering my work, if you have a serious digestive condition and you're really desperate and you need to know how to get your life back and get your health back and put your life back in order, you're in the right place. But I want to talk to you in this about a very important distinction between what we do here, what I share with you, and what I'm teaching in the Pivot Protocol about how you can heal your own body by targeting your symptoms, by understanding the root cause of your symptoms, and by applying specific solutions to your exact pattern of symptoms, which will change over time as you start to recover. Your symptoms will change. Some symptoms will improve, something else might pop up. You'll have a lot of good days, then you'll have a bad day. How do you deal with all of these changes? You do it by understanding how to interpret your symptoms, how to treat the root cause of those symptoms, and then apply specific solutions to your specific root imbalances. That's the Pivot Protocol in a nutshell. Now, I want to explain how that is different than the health and wellness fad diet industry. Okay? The health and wellness thing is really largely based on, hey, there's a bunch of supplements, herbs, amino acids, right? Natural health products, formulas, right? And they're all good for all people all the time. That's the implied, nobody's saying that, but that's what's implied in the whole marketing of. That's how you know it's a fad diet, fad supplement, fad herb, fad health and wellness kind of approach. That approach says that, for example, if you hear people say this all the time, right? You can read comments over and over. Oh, if you have acid reflux, you should take apple cider vinegar, right? I'm just giving you an example here. Okay, that's a popular myth that a lot of people then do, and some people see a little bit of improvement. I mean, there's no question it's going to help somebody, right? For reasons that I won't go into here, but of course it boosts a certain part of your digestive system. But what else is it doing to you? And is that good all the time? And is that good all the time for every person? No, obviously not, right? Obviously, there's plenty of people who are going to take apple cider vinegar when they have acid reflux, and they're going to get sick as hell because of what that does. So what's the missing piece of information? The fad diet, fad health, fad supplement, fad health and wellness industry is really based on, of course, selling you supplements, selling you a product, right? What I do here, what I share with you in the Pivot Protocol, what I'm selling is information. And I'm not even selling information that's good for everybody, that I'm giving one piece of information like a diet, right? The Pivot Protocol diet, right? People ask me, is the Pivot Protocol a diet? No, it's not a diet. It's a way of understanding how you should eat. So that you start by understanding your symptoms. You understand your specific imbalance. Then we know what solution to apply. So the answer to the question that I'm asked most frequently is, and the question I'm asked most frequently is something like, hey, is apple cider vinegar, right? Is X, Y, and Z, are probiotics, is this or that, or some fill in the blank, right? Remedy, trick, solution, right? Herb, whatever, right? Is this thing good for my acid reflux? And the answer to that question is always the same. I have no idea. Tell me what your symptoms are. Then we can start to talk about solutions to your specific problem. Okay? So, the difference between a professional medical system and fad health and wellness industry solutions, whether to acid reflux or IBS or any digestive, right, problems at the upper end of the digestive tract, like acid reflux, or problems all throughout in the lower in the lower bowel, in the lower digestive system, that part of your digestive tract broadly understood as IBS, irritable bowel syndrome. That's Crohn's disease, ulcerative colitis, diverticulitis, diverticulosis, autoimmune conditions, etc., etc., etc. Anything that's deep inside your organs and tends toward the lower portion, even stuff like UTIs, right, urinary tract infections, caused by, right, infection in your digestive system that gets into your bladder. Anything at that end. No matter where the problem is, right, there's an approach that says, hey, take all of these supplements because, you know, whatever the flavor of the month is good for you with your disease. We're treating your disease. That's the fad diet thing, the fad health and wellness thing. Versus what I'm sharing with you is there's a methodology by which you can understand your exact condition, understand your symptoms and how they are being produced so that you target your exact problem and you match it with solutions that are surprisingly easy. One of the things that I think is shocking when people get really, really killer results with the Pivot Protocol, and I don't do a lot to publish all the testimonials, but a lot of them are up from early on when I first launched this at pivotprotocol.com. You should go there. Sometimes people ask, like, does it work? I don't know. Ask the people who've gotten results on it, okay? I mean, it's not that old. It's not that long ago. As I'm recording this, it's not that long ago that I actually introduced this and started teaching this online. So, you're talking hundreds and probably at this point multiple thousands of people, many of whom take the time to write me about their experience. And I'll continue to post those so you can see for yourself what other people have to say. But if you're new to this program, right, your questions are going to be like, well, how do I know it works and what makes it different, right? What makes the Pivot Protocol different for any digestive condition at all is this. This is not a one-size-fits-all solution to digestive illness. This is a very old, very archaic, kind of ancient system, medical system, ancient approach to treating the various ways that your digestive organs can go out of balance. It's not like the modern medical system, like the emergency medical system that we have, where all of the thinking is tied up in like, oh, you have acid reflux, you have too much stomach acid, so take a pill to block your stomach acid. That's far too simplistic for something like chronic digestive illness. Obviously, not everybody with acid reflux is going to get better taking an acid blocker. In fact, they make you worse for reasons that I explain. But it's also not the fad health and wellness industry that says all natural supplements are somehow better because they're natural, and that anything that we sell you should take as much as you can of because what's natural is better for you, and that's how you cure your acid reflux. Taking too many supplements, taking the wrong supplement for the wrong reason, will make you sicker. It will make your reflux or your IBS or any digestive condition will get worse because of what these supplements, because all supplements, just like all pills, just like all medications, require your body to work harder to digest and metabolize them. All supplements add heat to your liver, all of them. Unless you're taking something that specifically clears heat from your liver, and in that case, you're going to damage your spleen. Okay? I go into all of this in the Pivot Protocol, but my point here is, whereas the modern medical system is far, far too simplistic with the whole, too much stomach acid, let's take an acid blocker. If you're watching this, you already know that doesn't work. Okay, if you have IBS and they're like, oh, no problem, we'll put you on antidiarrheal or antispasmodic drugs for intestinal spasm, or we'll put you on steroids for your autoimmune disease. That's all short-term emergency thinking. Okay, you're not getting well from a chronic digestive disorder if you follow short-term, very narrow thinking that's too simplistic for a chronic, complex, sophisticated digestive disorder. Okay, but the fad health and wellness industry is, hey, all things natural are better. We sell natural remedies, so you should take all of these that you can possibly afford to take. In fact, you should take them even if you can't afford them, right? I mean, that's the basic marketing message, okay? And all of that, too, will make you just as sick and just as miserable as using emergency medicine. But here in the middle is this sweet spot where this very old medical system that I discovered and that I'm bringing to you in this program actually is designed to treat chronic illness. Why? Because chronic illness is never one thing. By definition, what's happening with chronic disease when it's internal is your organs are now fighting against one another. They're actually working against each other. So we need to turn that around so that your organs work together in harmony again, so that one is not attacking the other, is causing problems in this one over here, and you get in this negative feedback loop. That's a very difficult thing to break if you don't know how that's happening, and that's what I share with you in this program. And the difference that makes this natural healing system, because it largely is a system, I actually do recommend one specific prescription medication that you can ask your doctor about if you don't know about it, right? I include that in the advanced training. It's very important to remedy food stagnation. But you need to understand when you should use that. It's not like I'm telling you should go out and get a bunch of pills from your doctor. I'm not saying that at all. I'm saying in a specific scenario, you may benefit from this, and you have to decide if you have the symptoms that match up that tell you that the cause of your problem would be possibly remedied by this medication. And then you can talk to your doctor and see if it's right for you, et cetera, et cetera. And it's the same thing with the supplements that I talk about. I only recommend about 3 or 4, maybe 5 at this point, so-called natural remedies and supplements. And the reason for that is, for the most part, you don't need them. I'm not selling them, so I'm not trying to make money off of, right? I don't make money telling you about these supplements. It's just good for you to know, because I've done enough of the research and I've worked enough in clinic with other patients to know that a certain number of people will benefit from, right? And I outline 1, 2, 3, 4, probably 5, maybe 6, I would say, different remedies that I tell you about that you can apply. If you have these symptoms, look toward this remedy. It may help you. It's probably safe to try it, and it doesn't cost you a ton of money trying to figure all that out on your own. That's very different than saying, hey, you should take this herbal formula, this amino supplement, right, this so-called natural remedy every day as much as you can cram down your throat. Okay? Because all of that causes more problems than it helps to remedy. But if you have a system designed to help you understand the specifics of why a specific remedy will help with a specific scenario, then you have a way to actually remedy your condition. And when your symptoms change, because they will change, your symptoms will shift. As you start your healing process, certain things are going to go away, and then other problems will crop up. Or you'll notice other problems. It's like, yeah, I'm getting better, but now this is my main symptom. Okay, how are we going to target that symptom? Okay, how are we going to target that imbalance? We have to change. You have to change your approach. When things change inside you, you have to change what you're doing to continue the healing process. Otherwise, the thing that you did to get a little bit better at the beginning of your healing journey will now cause you problems and make you sick in a different direction. Okay? So, to sum up, my friends, the main thing that makes the pivot protocol, whether for, again, I teach now about acid reflux, and if you're watching this, you may already be a member of my program for IBS. The same fundamental principles are illustrated in both programs. But obviously I'm targeting different people so that I'm talking to your specific problem if you have acid reflux in my pivot protocol. And then there's a pivot protocol IBS for people with lower bowel problems mostly. Chances are if you have one, you may develop the other. There's no question that they're related, but it allows people to find me for different, actual different patients will find different programs. And the main thing here to grasp is what makes this approach so effective and so different is the pivotal, the essential criteria in a professional medical system is diagnosis. Now, I'm not teaching you to diagnose yourself in a way that's dangerous or that's beyond what an individual should do, but In an emergency medical situation, like if you go to the doctor, you got to get to the emergency room, what you're doing is you're praying that the doctor who's taking care of you because you were in a car wreck or you have a massive hemorrhage or a heart attack or whatever, all the emergency conditions we know about, the doctor is 100% in control. You are 100% passive while you're on the emergency room table, and you're hoping that the doctor's going to pull a rabbit out of his hat and make sure that you survive. That's emergency medicine in a nutshell. You have no part to play except to lay there and hope that things go well. But with chronic disease, the essential criteria is the patient must know what's happening and must, to some degree, have enough of a clear understanding of what's taking place. And this is so crucial in digestive illness. You have to have an idea of what's happening and then take some amount of action on your own. You're sick. A chronic condition is every day you're sick. Every day you're out of balance, right? So if you're suffering chronic symptoms, you need a way to actually treat yourself by understanding your condition and then taking small steps to make sure that, number one, you're not getting worse. That's phase one, right? And then the advanced part is how do we proactively reharmonize these pivotal organs so that the body heals itself? That's what we're doing inside this protocol. The pivotal cognitive operation of any professional medical system is diagnosis. Diagnosis means we are matching your symptoms, your imbalances at the root level to specific solutions. We are not taking a solution for some people and applying that to everybody based on your disease. We're getting to the root of your imbalance, and then we're taking a specific solution for that specific problem and applying exactly that until that problem remedies, goes away, improves, and we can move on to something else. Okay? And you do this over and over again until your body recovers enough on its own that it takes over the healing process. And by and large, the good news is like, the bad news is if you're sick, it's hard to get well. The good news is once you get well, your body will by and large keep you well unless you go back to doing stupid things that you know you shouldn't do. Okay? So the important part about this video is there is a way to target your specific symptoms. This is not fad wellness healing, right? This is your understanding of your condition. That's what I'm teaching you. And then you can figure out the surprisingly simple solutions that help with your exact organ imbalance. Okay? That's what I want to share with you in this video. And I really appreciate all the feedback I get from you guys, especially when I get reports from people who have done great jobs healing themselves. So please keep that feedback and send me your questions as usual. And if you haven't gotten started on the Pivot Protocol, either for acid reflux or for IBS, why not? Why not, right? You actually have very little choice, right? You're going to have to figure out your own digestive condition. If you're finding this video, if you're finding my program for the first time, I really hope you go for it. You know, I'm very, very encouraged by how much this has helped people over the last several years since I launched it. And really, what do you have to lose? I'm a real person with a real solution to a very vexing set of digestive issues that your doctor knows nothing about. Your doctor cannot help you with the kind of things that we're dealing with here. And if you're finding this program because you have a chronic digestive imbalance, you kind of owe it to yourself to try this. I mean, it worked for all these other people. Why wouldn't it work for you as well? Okay, so that's my message to you, and I hope you go for it. Thanks very much.